You are listening to The Scope, Phelps Health Podcast, Episode 14. Today we're going to be talking about heart health. Let's get started. Hi everybody, I'm your host Paige Hyman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channels. You can also find us on Twitter, Instagram, LinkedIn, and Facebook. All links are in the show notes. Now let's get into the show. Today our guest is Dr. Arslan Shaukat, a cardiologist with Phelps Health Medical Group. Welcome to our show today.
Thank you for having me.
Yeah, absolutely. So go ahead and tell us a little bit about yourself.
Yeah, so I have been here at Phelps Health for about 2 years, and before this I did my cardiology training predominantly in Kansas City, and then I did some training up in Minneapolis, and then I moved down here. Originally I'm from Pakistan, so I did my medical school over there, and then I came to the U.S. for residency and then for further training, and yeah, that's about it.
So cardiology is pretty specific. Why did you choose that field to go into?
Yeah, so I liked cardiology from an early stage. I think it was in medical school when I really took to it. I think the one thing I really like about it is that it's based on the principles of physics, so it's very intuitive. So I like that aspect, and then I got exposed to the clinical aspect of it, which I also really liked. And then I think one thing that also attracted me was that there's just such a large burden of cardiovascular disease globally, that it's a field where you can make an impact, you can make a difference. And on a personal level, also when I was in medical school, my dad actually suffered from a heart attack at that time, and that got me even more interested in the field, as to understand why why these things happen the way they do, and just work towards that.
Yeah, you have a personal experience with it.
Yeah.
That's really fantastic. Well, I know that we really love having you here, and we don't want you to leave. Your wife is also pretty new to Phelps Health as well. She works in sleep medicine, which is really awesome. But today we're going to dive in and talk a little bit about heart health and specifically what it means for COVID-19. So heart health is always an important topic, and it's always kind of top of mind, like you said. It's not only affects a lot of Americans, but it affects people worldwide on a global scale. And one thing that we've learned through this COVID-19 pandemic is that heart health may affect a person's risk for severe illness if they have COVID-19. So what is heart disease? Let's go ahead and start there.
Yeah, that's a good place to start. I think so. Heart disease itself is a broad category that encompasses different types of conditions that can affect the heart, and these conditions can include those that affect the vessels, the blood vessels in the body, but also the blood vessels in the heart, something that we call coronary artery disease. Along with that, any problems that can affect the heart, in the rhythm of the heart, so arrhythmias, the heart valves, or even the muscle, the heart muscle itself, such as heart failure. So it's essentially a group of all of those disorders.
So let's say somebody has heart disease and they get COVID-19. We hear a lot of these really crazy terms thrown out on the news, like myocarditis or stress cardiomyopathy, which I've heard is called broken heart syndrome. What are some of those things, and can you break those down for us? Those are really big terms that are hard for just the normal layperson to understand.
Sure. Yeah, so I think the one thing that we have seen is that COVID-19 can certainly affect the heart in different ways. Now, one way that it can do that is just because of its severe effect on the body. So it causes severe inflammation, and it also causes low oxygen levels when people are infected with it. And that itself can cause strain on the heart. So that's sort of an indirect way that it can affect it. But there are also direct ways that the virus can affect the heart. So one is that it can actually cause inflammation of the heart muscle, which is what is termed myocarditis. So that in itself can lead to weakening of the heart muscle and what we call heart failure. So that's one thing. The other thing that you mentioned is the stress cardiomyopathy. So that basically is a condition where there is an abnormal stress response of the body that causes a surge of stress hormones,
Okay.
and those stress hormones impact the heart in a negative way, and they cause the heart to become suddenly weak. And so that's the common term is used is called broken heart syndrome. So that stress in the body can be a physical type of stress, such as an illness, or it can also be emotional stress. But in the case of COVID-19, it is the severe physical impact of the illness that causes the stress, and the heart, as a result, becomes weak. So that's what we call the stress cardiomyopathy. So there's that, and then there is also just the incidence of the heart getting weak by itself, or people developing heart failure, that we're also seeing after COVID-19. And then there are some people who have more severe type of COVID-19 infection, and there's a term called a cytokine storm, which is where some people have a very abnormally aggressive immune response.
And can that happen at any age, regardless of how healthy you are? Can you fall into this storm?
Yeah, so it happens more commonly in people who are older.
Okay.
And it has to do with how the immune response behaves as we age. Younger people are somewhat more protected against that, but that's why we tell the older people to be even extra careful, because they're at a higher risk for that, and hence at higher risk for more severe infection and higher risk of dying from it.
So whenever you talked about myocarditis, that made me think of something else too, because you talked about like the weakening of the heart, or even with this broken heart syndrome. Whenever the heart becomes weak, can it ever repair itself from that, or do you just always have a weak heart after something like this happens?
Yeah, so that's an important question. So I think so far, obviously, our data in terms of at least COVID-19 is evolving, and it will continue to evolve, and we will see some of the sequelae in the future as to how well people recover in terms of their other organs, whether that's the heart or the lungs or kidneys. And so right now we don't have a great answer to that as to, in particular for this specific cause. If you look at other types of causes that in the past, when someone gets a viral infection that causes myocarditis or the inflammation of the heart muscle, generally it's about a third of the people will get better and return to normal. A third can stay about the same. A third can get worse. For COVID, as such, we don't have a great answer right now. I think with time we'll start to have more of those answers. But and then other than this inflammation, the COVID-19 also increases the risk of blood clots. That's the other thing that we're seeing. So whether that's blood clots in the veins or in the lungs, but also in the heart arteries. And it can also cause some of the plaque in the arteries of the heart to become unstable, which is something that can lead to heart attacks. So,
do we know how severe those blood clots are? Or can they pass themselves, or can they become very severe blood clots?
So in some cases they can become quite severe, and that's one thing we are seeing as well. And people are sharing that information. It's happening globally, and we are seeing that. So we can see them, like I said, sometimes in the veins, but also in the lungs, which is called a pulmonary embolism, and in the heart as well. So some of them affect the person quite significantly as well, and can lead to their further decline. And so I think we're really trying to come up with a really good strategy as to how do we prevent that and how do we treat it the best.
So something else that we may not even really know any information about, or that may come within the next couple months or the next couple years, is what are your thoughts on how mental health and stress affects our heart, and also in correlation with that, COVID-19? Like, let's say somebody is really, really stressed and they get COVID-19. Is that going to have an impact on their heart? Or is there any type of correlation with that?
Yes, so actually one thing that we have seen, and there was a recent study that came out of Cleveland Clinic, that the number of people that are getting admitted for the Takotsubo, or the stress-induced cardiomyopathy, or the commonly called broken heart syndrome, has actually even doubled since the pandemic actually started. Yeah, and so I think the reasons for that are that the pandemic has, apart from its physical impact, has also caused a great deal of psychological impact. So there is certainly the anxiety and the emotional stress that it brings to people that in terms of being worried about contracting the disease, and then also being worried about their family members, whether it's their, whether it's your parents or grandparents or other family members that that we're all worried about them getting it too. So all of that leads to additional emotional stress, and we know that emotional stress is actually one of the triggers for stress cardiomyopathy or the broken heart syndrome. And so that could be leading to it, and then certainly there's also the aspect of the social isolation that this pandemic has brought, which further worsens things like depression and just increases the stress levels. And we know that whenever the body is even under emotional stress, it is at risk for getting infections as well.
What are a couple of ways that maybe you personally or you would recommend people to work against the grain whenever they have that type of stress or mental fatigue within themselves, so that maybe they don't get that broken heart syndrome?
Yeah, so I think that's one thing that we're really trying to encourage people, that especially in this current environment, that they find things to do that they like, find ways to get rid of the stress or the isolation, and such as spending time outside, doing some physical activity, and just sort of to help themselves sort of de-stress in a way, and then also stay physically healthy at the same time. I think it's just increasingly important to find new ways to do that.
Yeah, I've noticed a lot of people are really sad or upset or angry, whatever you want to call it, that they can't go to the gym or they can't do their normal physical routine, but they can still go on walks around here because we live in a rural area, so we have a really great opportunity to walk the trails or to walk our neighborhoods, and we can be distanced, and we don't have to wear masks whenever we're distanced like that. So for myself, it automatically takes that stress away because I can walk with my dogs and I don't see anybody.
Exactly, and that's what I think is the best thing to do. I think because one, it gets you some time outside, and like you said, it's a safe thing to do, and there's usually something that we can find doing outside. But even if it's not that, and if you find that it's too warm or something like that, then there's exercises at home that you can also do.
That's why we have YouTube.
Exactly. You have those, or you have other types of videos that you can follow. These days, there's even more of them. So there's equipment also, now that's available that you can really use at home to just be able to get a good amount of exercise and still stay healthy.
Well, even for older people too, they can still do chair exercises. So they don't have to get out and walk and do a whole bunch of physical exercise. They can do sedentary things and still be active, which is awesome.
Exactly.
So another question that I have, kind of going back to COVID-19, is if somebody has COVID-19 and they recover from it, should they follow up with a cardiologist, or at what point should they follow up with a cardiologist?
Yeah, so I think that if they don't have any previous heart problems, then of course they should follow up with their primary care physician, and if it is determined that they may have had some negative impact to their heart as a result of the COVID-19, then I think that they should be referred to a cardiologist. Otherwise, if they have a previous heart condition, then I think those people should certainly see and follow up with their cardiologist, just to make sure that they haven't had any negative impact from the COVID infection, and have everything checked out.
So if we're seeking medical care, we want to make sure that we're always doing what we need to do when we're supposed to do it, which is really, really hard, I know, to do in the midst of COVID-19, when we want to stay home, we want to cancel all of our appointments. But how do we know when to differentiate between like a heart and stroke symptoms and that of COVID-19? Because some of those symptoms are very similar.
Yes, and I think this is a very important point. And I think this is one thing I would really like to stress, is that people should not ignore concerning symptoms of other things. Now we know that right now a lot of our main focus is on COVID-19. However, all the other conditions don't go away, and all of those things can still happen. And so in terms of COVID, the predominant symptoms, and there's guidance from the CDC on this, but the most common symptoms that we're seeing are either fever or chills, cough, shortness of breath. But there can also be other symptoms like muscle aches or pains, loss of taste and smell, or get GI symptoms like diarrhea, nausea, vomiting, things like that. Now, some of these symptoms, such as shortness of breath, can also happen with heart or lung condition, other lung conditions too. But for the most part, what we're seeing is that the symptoms of, let's say, a heart attack or the symptoms of a stroke, even in people who have COVID-19, are still very similar to what they would be otherwise. So you should still be on the lookout for those usual symptoms of, such as sudden chest pressure, pain, pain running down the arms, for a heart attack, suddenly breaking out in a sweat, suddenly getting short of breath. And then for a stroke, if you feel a sudden onset of suddenly getting weak in one arm or leg, or a droop in the face on one side, or trouble speaking and things like that.
And don't be afraid to call your cardiologist if you have one, your primary care, or to go into the ER. I think that's really important too, because a lot of people, I think, are still scared to go to hospitals, even though the hospital is one of the cleanest places you could be at right now. It's one of the safest places, really.
Yes, absolutely. And I think that is actually one of the really unfortunate sort of side effects of this, that people, of course, being afraid of contracting COVID-19, are not really seeking medical care that they should. And in terms of heart attacks, we usually say seconds count, and nowadays we're saying seconds still count. So a lot of these other conditions are serious conditions that are time sensitive, and so I would really stress that people should not wait on any of these symptoms. If they have something concerning, they should go to the emergency department as soon as possible, so that those things can be taken care of. And if it's something else, then so be it. Because of the fear of COVID-19, we should not be in a situation where we don't seek care for something else.
And this is one of the questions I had, and we talked a little bit about this before the show started. And the question was, have you seen a decrease in patients seeking care for their heart since March, when COVID-19 became a health concern? And you had kind of alluded to maybe you have some older patients who aren't necessarily comfortable with telehealth, so they've elected to wait to come in for their appointments. But let's say some of those patients waited too long, and those seconds do count, and maybe they have a heart attack or a stroke or whatever it is. It is so important for them to make sure that they get in for those appointments in any way, shape, or form. Can you talk a little bit more to that, just to kind of reiterate?
Yes, so there are two aspects to this. One is continuing your normal care as an outpatient, and taking care of chronic issues. And as you mentioned, even if there is not an in-person appointment, there are ways to do, such as a telemedicine visit. Or if not that, then at least I think that everyone should stay in contact with their healthcare providers and make sure that they're still getting all of their prescriptions refilled, and they are still taking all of their medications and continuing all of those things. And certainly they can find ways to see their healthcare provider, whether that's in person in a safe way or through telemedicine, which is also a very effective way as well. And this way they can continue their care almost as per usual. I think that's the one important aspect. The other aspect is if there's something that happens suddenly and something that needs immediate medical care. So in terms of heart attacks, yes. So around the world, in multiple countries, we have seen that the number of people coming in for heart attacks into the hospital has gone down significantly, about 50 to 60%.
That should scare us, right?
Yes, and that does not mean that heart attacks are not happening. It means that people are not coming to the hospital. And unfortunately, we have seen some complications when people have come in much later time, by which time a lot of the damage has been done.
What are some of those complications?
So some of those complications are severe heart failure, or when your heart becomes so weak after a heart attack because you did not get the
care that you needed,
the treatment immediately, or things are even more serious nature, and those things we were not seeing before this, but unfortunately we have seen that because people came in much later to the hospital. And so I would really again emphasize this, that people should, especially if there's concern for a heart attack, come in as soon as possible, and so that those things can be avoided.
So we're kind of nearing the end of our show, but again, and I know we've been talking about this for a few minutes now, I want to give you an opportunity to speak directly to the listeners of our show about coming in to seek care and making sure to care for their hearts during this time, and even whenever COVID-19 is done, to continue to care for themselves.
Yes, so again, I think as we had been talking about, I think it is extremely important, especially in the current situation, that we continue to take care of our heart health, because those problems don't go away, and it is while it is important to stay safe, it is also equally important that we all seek the care that we need, and especially in times that there may be something more serious going on, such as heart attack or anything of that sort that is concerning from a heart standpoint, that we continue to seek timely care and going to the hospital if and as needed, and at home continuing to take our medications, especially heart medications, and then staying physically active in any way that we can find, and staying on a healthy diet as well.
Great advice. Thanks so much for tuning into The Scope. If you liked our show and would like to know more, check out phelpshealth.org. Thanks so much.